Hi, I'm going to give you a quick walkthrough of the basic types of pages that you'll find in one of our anatomical model labs. So let's jump right into it. The first of our content pages, apart from an introduction and materials page of course, is a broad overview page. So we're looking at the skeletal system model lab today. So for the broad overview page, that means we're looking at the axial and appendicular skeletons and counting the bones and classifying which division of the skeleton the bones belong to. So you'll see some illustrations here along those lines and also those bone identification activities. And then students are also introduced to classifying bones by their shape. They get to learn all the different bone shapes and get examples of each one. And then they have a little tutorial on all of those bony landmarks that you're going to ask them to identify later on in the lab. So you can see these highlighted regions really help train their eyes for what's ahead in the model lab. So this is a basic overview page, that broad general information. The second type of content page we have is that main content page, where students are actually sitting down with the models and identifying the bones and feeling those bony landmarks and prominences. So I'm going to go to the shoulder page as an example of this. Each of these pages starts off with an identification section where they're identifying the bones, making notes to remind themselves of how they'll remember it in the future. And then after they're finished with that, they look at each of the bones in greater detail. There's a series of mini pages here, and you'll see that each one has a little section at the top with basic understanding information. And then there's a palpation exercise as well, so they get practice of feeling these bones on themselves or their partners. And then there's also a label image section that helps kind of solidify the knowledge of the bony landmarks. So if they're not sure which ones are which, they can use this question to aid their understanding. And of course, there's rich feedback provided that helps deepen their understanding as well. After these identification questions, there's a human dissection simulation. This is housed within our hotspot panel. And you can see here there are muscles overlaying the bones, so students can kind of relate the muscles to how they insert or attach on the bones, and then you just zoom in, continue to zoom in, and you just get this layered approach to your learning. And we can actually drill down all the way to the carpal bones, and I can click on them and it tells me what bone it is and why it's named the way it is, or a little information about its shape, so they can remember it later. And you can also see a bunch of questions along the side here. All of them have rich feedback for students to really solidify their understandings. And finally, a test your learning section, which again just helps reinforce all the learning that they've done on the page and really introduces them to some medical imagery so they can kind of get excited about using these types of images in their future careers. One great thing about these questions is that even if they get them incorrect, they're still given feedback that helps them find the correct answer. These pages are really great if maybe your lab is closed and students still want to study. This page is really rich with information that they can visit at any time and help them feel more confident with the material. So that was a main content page. The next type of page I want to show you is a clinical application page, and this really just brings the learning to life and relates the structure to the function. So on this page, students are introduced to a couple of simple clinical cases. You'll see an x-ray there. Here's another label image question. This one, for example, is a young baseball pitcher who arrives to you having shoulder pain. So the first thing we ask students to do is identify the anatomy of the area. After that, they're asked about the joint, what type of joint it is, what type of function it should have, relating that structure to function. And then they're asked to make a diagnosis and read an x-ray. So here they're kind of coached through reading that medical image with a high quality illustration as well. And this is just fun for students because they can actually picture themselves doing this in real life in the future. So that's a clinical case page. And then the final type of page that we have is a review and integration page, which really synthesizes all of the information they've learned in the lab and kind of double checks that they remember things, and it's just a great study tool. So these pages start off again with structure identification questions, a lot of labeling images, remembering those bony landmarks and the bones. And then there's a critical thinking question, which actually makes students kind of retrieve information from their memory instead of just recognizing a label all the time. And it really just helps them prepare for any exams and prepare for their future careers and just think a little bit more critically about the information they've been presented with. So these are the 4 types of content pages you can expect to see when you look at one of our anatomical model labs. We went through an overview page, a main content page when they're sitting with those models and really figuring out all those different things that you need them to identify. Then there's that clinical application page, which relates the anatomy structure to the function. And finally, the review and integration page that brings everything together. So we hope you like the look of these anatomical model labs and check them out and use them in your classroom. Thanks so much. Bye.